It's time for myth versus fact. So we're going to ask Dr. Erickson a few questions. He's going to hold up his answer and we'll see how many you can get correct. First one, myth or fact? Being strong can prevent an injury.
Fact and a bit of a myth. So my explanation would be strength is important, but if you're strong but don't have flexibility and don't have otherwise good fitness, strength by itself is not a factor that would prevent injury. One can still get injured, and strength is a good component to prevent injury, but it has to be combined with the other portions as well, such as, once again, flexibility, cardiovascular fitness, etc.
All right, next one, no pain, no gain.
Big myth, big myth. It's something that I say in my clinic all the time. Rarely is no pain, no gain a philosophy that we're going to employ. That's a historical way of training, somewhat to speak. So that is an absolute myth.
Okay, that's an easy one to remember.
Yes.
All right, applying an elastic bandage to a severely sprained ankle is good treatment.
Myth. An elastic bandage isn't a bad first-line treatment, but it cannot be the only treatment. There are other modalities that have to be implied, and that can be a therapy approach, an anti-inflammatory approach, an icing approach. All of these things are necessary for a good outcome.
Okay. Myth or fact, plantar fasciitis is a hereditary disorder or problem?
Myth. It's a very common problem, but not hereditary. And once again, using the appropriate measures, one can get over that problem.
Okay. If your back pain lasts more than 2 weeks and it keeps you from participating in normal activities, that's when you should see a doctor.
After 2 weeks, I would say that's fact, okay? Now, there are some extenuating circumstances. Having back pain by itself and doing the appropriate conservative measures, if you have neurologic symptoms with back pain, that's something we want to see sooner.
Okay. And our final one, an ACL tear will end your sports career.
Well, that's a myth, okay? I do many ACL reconstructions, and one of the greatest joys I have is seeing my athletes back on the field, reading about them online, in the newspaper, etc. Unfortunately, there is a small percentage of people that are not able to return to play. There's no surgery that's 100% effective, so it's still very effective. We get people back, but that requires so much effort, energy, therapy. I'm just one small component in that.
Okay, there you have it, myth versus fact with Dr. Erickson.